medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Often forgotten is that our adrenal glands play a major role in our stress, inflammation response, pretty much in life in general. The cortisol basically regulates your body's stress responses. It helps control your body's use of fats, proteins, and carbohydrates. It's basically your metabolism. It suppresses inflammation. It regulates blood pressure as well. It also regulates blood sugar. So is this important? Obviously, very so much. Helping control your sleep-wake cycle is also part of cortisol intervention. Sometimes we find that when things are not right, our patients will complain of either weight gain, especially in the face and abdomen, fatty deposits around the shoulder blades, wide purple stretch marks on the body, for example, muscle weakness in the upper arms, high blood sugar. Pretty much that can turn into type 2 diabetes. All of this maybe could be averted or helped if we looked into someone's cortisol different levels, because it does make a difference. We also find we can see hypertension, hirsutism, particularly with people, weak bones can occur. So the answer or the question should be, okay, in my patients, how do I test this adrenal hormone? What are some of the pitfalls? And how should I do this? And I think if I can, in just a moment, and I'm Dr. Mitch Ghen, and I will give you just a little tiny primer to make your life very easy, because the first thing you have to decide, are we going to use blood versus saliva, free versus unbound? As you know, the saliva, when done properly, this sample, it's typically the unbound, whereas the blood is a combination of the bound and free. But sometimes you need to have both done, and I will recommend that for you in a moment. False specimens when it comes to doing a saliva samples, it could be from brushing your teeth, having coffee and other drinks before you do this particular sample collection, some dental treatment, you decide to floss, or if you have bleeding gums, because as you know, in the blood is both the bound and the free forms. Not stopping hormone replacement therapy in enough time before doing the test could also interfere. Even something so silly, which maybe the patients wouldn't think of, is touching the sample container with the same hand you just use for taking a particular hormone or cream or gel. And again, of course, having some contact with a partner who uses a cream or gel, and then you transmit it as well. Also, probably less known is if you do a lot of sports before collecting the sample, it may change things too. Now, there's other things involved in checking the adrenal hormone cortisol levels. That if the T3, the free T3, is decreased, clearance actually slows down. And you have to keep that in mind. You should always check the other things from the adrenal gland: dehydroepiandrosterone, pregnenolone, and you should be aware that progesterone topically can interfere because it looks like cortisol. Remember the cascade, how it goes from cholesterol and pregnenolone and so forth. Also check the blood cortisol level as well. It may be different. Hyperthyroidism and obesity can cause an increase of unbinding of the free and put it into fat. So theoretically, you can have a very low free, very low high, or vice versa, and be confused. So I would make sense, in my opinion, is to get a morning cortisol level, like around 8 o'clock, 9 o'clock in the morning for the patients, and do 4 saliva samples. Do it correctly, making sure that you follow the instructions as to time, clearance, not putting anything in the mouth, washing the mouth clear 15 minutes prior to the sample being done, and of course never spitting but only drooling, for the fear of any gum disease, putting some microliter, smallest amount of blood into that tube, which would very much skew the test and make it look like something else. Also, be know that low saliva in the morning and high in the blood can occur, and that happens again because of obesity or the way it's metabolizing. Get these tests T3 free. Look at a morning cortisol by serum. Do 4 spot of the saliva sample, and of course, check the DHEA and pregnenolone, which also come from the cortex of the adrenal gland. Hopefully that will give you an idea where to go, and if you have any information or more things that you'd like to know about, just let me know at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching.